Okay, sorry. So, as we talked about the stiffness, as I said, like muscle tension is the #1 reason you feel stiff. All the other reasons, like a poor posture, lack of exercise, stretching, cold air, all those things contribute to the muscle tension. So find the way to relax your muscles, okay? That is the reason even the breathing techniques helps with your stiffness. When you're doing the meditation, when you're doing the breathing technique, that helps, okay? Posture definitely helps because we are in really, really bad postural habits nowadays, okay? Especially nowadays. All right, now let's talk about how to check your posture, because posture is a big thing, and I'm a big believer in posture. If you have attended any of my workshop in the past, you know I'm a big believer in the posture. You fix your posture, you can fix so many things. Now, how do you know if you have a bad posture in your back? I'm talking about particularly the back. So there are a couple of ways you can find out. So let's talk about that. So the first thing you can do is simply, I'm going to demo 2 ways I'm going to lean forward. Tell me which one is better or which one I did good. Okay, so simply I'm leaning forward. Okay, so the first one I guide like this. Okay, so you see my back is kind of rounded versus this. Now, the way you can tell, take a stick. Okay, if you have a stick at home, get it. You notice my sacrum, my lower back, my upper mid back, and my head. Everything is touching. When I lean forward, everything is still touching. Okay? If this happens, that means I'm compensating. If my head is going back, that means my neck is compensating. So when you find out that your back is not going forward the way it should be, that means your posture is bad. Okay? And you get in a habit that think about it throughout the day when you're trying to pick up things from the floor, or when you're trying to, like, lean forward to do your daily activities. How many times you put the strain on your back with that back? Because when you lean like this, you're putting a lot of strain in your lower back muscles. Okay, and that can lead to a chronic back pain. So how do you fix that? Every morning, if you don't have a stick, that's okay. Keep it simple so you can do every day. Keep your hands like this in front of the pelvic. So you see now, when I'm leaning forward, my fingers is going forward like this. That means I'm moving my pelvic. Versus this. See, when I'm doing this, my fingers are not moving forward. When I do this, my fingers are going forward. So first thing when you wake up in the morning, practice this. While you're doing brush, after brush, before brush, practice maybe 10 of this, just leaning forward and backward. Why? Because once you practice every day, that becomes muscle memory. Then even unknowingly, when you're trying to pick up something, you get in the habit of using the right posture. That is the reason you need to follow that. That's the #1 for posture. Second is your hamstring. When you have a tight hamstring in the back or tight hip flexors, that tilt your pelvic. So our lumbar has a lordosis. That means like you have a curvature like this in your back. If it's too much, we got a problem. If it's too less, we got a problem. Now, many times when people has tummy, that time when it's like this, it arches your back. When you arch your back, it increases the pressure in your lower back. More chances of back pain. Okay. So now, what happens when that happens? Your pelvic tilts anteriorly. Same thing when your hip flexors, these muscles are tight. That time, when it's tight, what it does, it tilts the pelvic forward. Okay. When your hamstrings are tight, it pulls the pelvic backward. Now you got a flat back. Both case, you got a problem. Okay. So to check your hip flexors, whether it's tight, the simple test you can do is simply go in the bed and bend your knee all the way up. If this leg stays down, that means you don't have hip flexor tightness. If it goes like this or like this, that means you have a tight hip flexors. Okay. Now, the other one, the hamstring, you lift it up and then straight. See, like this one is less than 20 degree, my hamstrings are okay. If it's less than 20 degree, that means my hamstrings are tight. So that's how you know whether your hamstrings, your hip flexors are tight or not, okay? Because based on that, you have to decide what exercise you need to do. Either you need to work on the posterior tilting or anterior tilting, because not all the exercises are same. Because when you Google your exercise, okay, they don't know whether you have a increased lordosis or you have a flat back. That's why you need the customized program. If you do random stuff, it might work because it can be a coincidence. You looked for some exercise and that exercise is for, like, increased lordosis, and you happen to have increased lordosis. But if you consciously make a choice that, hey, I have a lordosis, I need to do this exercise, you search for it, then great. But randomly you do it, there are chances that one, it might not get better, or second, it might get worse. Okay? All right. Another one is the side bending. This is also one of the reasons people feel more stiff in the morning. One of the QL, which is quadratus lumborum, which is a deep muscle, goes from your hip to kind of a rib cage. Okay? So the very simple way you can say is when you stand like this, when you lean on the side. All right. Naga says, what is the correct posture for sitting? I'm going to go that once. I'm going to go over this standing posture, sitting posture, sleeping posture, and active posture. I'm going to talk about that after this. Okay. So when you're like this, when you go sideways, if you're crossing your knee, you see. When I go, see, I'm not compensating. My hand is crossing my knee. That means I'm okay. Both sides, check it, but I don't want to go like this. Don't compensate, okay? Or go like this, okay? No, hip stays there. You just bend from the back and trying to go down. That's how, if you're kind of here, that means you have a tightness in QL. So that's how you know where you have a tightness. All right. Now let's talk about the posture. So standing posture, as we're standing up, let's talk about that, okay? So when you say standing posture, so when you're standing up, many times with the chronic back pain, people has pain even just standing up, okay? So now, what I tell people, let's say you're standing up and you have a back pain, tight your abdominal gently, okay? Many times the people has a back pain when you're standing up because their lumbar lordosis, again, that curvature is a little bit extra. When they have that increased curvature, that's where the problem happens, okay? And that could be one of the reasons is big tummy. It goes like this. So now, as you can see, pressure build up right here, and you got it, some pain. So to fix this, all you got to do is tight your abdominal, okay? So your pelvic is tilting backward. When you're tilting backward, you're reducing your lumbar lordosis. That can take care of your pain. Now, what you need to make a habit is gently engage your core. When you engage your core, when I say engage your core, means you're tightening gently, not too much, okay? Gently tightening, that increase your posterior tilt, and then when you walk, you can walk longer time. People with the stenosis, let's say somebody diagnosed with the stenosis and they cannot walk longer. They walk 1 mile, 2 mile, and they say, nope, I can't walk anymore. My pain is radiating. My pain is severe on the back. The reason is because the pressure build up in your lumbar. Because of the curvature, you're increasing your pressure. At that time, if you just gently tighten your abdominal, do the posterior tilt, and then you walk, definitely you will be able to walk more. Okay? So that's the standing posture. Now let's talk about the sitting posture, because that's most important, because people nowadays, the job requires a lot of sitting. So when you sit, your lumbar has to be supported if you already have a pain. Okay, so way you can do it, let me get the chair so I can show it to you. All right. So let's say we got the chair. When you sit, see, I'm all the way back. When I'm going like this, so my back is supported by this. Now this chair, when I go like this, and if you do the computer work, you can't do it because that's not the way we do it. We wanted to do this. So many times what happened, one second, just tilt a little bit. So many times what happened, people got the nice chair with the curvature, with the adjustable height and everything. But then they forget that when you do this, yes, your back is supported. But when you're working, your back is not supported. So when you sit properly, great. Yes, you can sit straight and you're okay. But many times when you're working, you got emergency email, you're involved with the work, you forget, you lean forward, you slouch. Okay. So to fix it, what you can do. One, you need to make sure you have a lumbar pillow or something. So if your chair is deep and you cannot, your back is kind of flexible like this, okay, you want to make sure you have extra lumbar support. So you can simply get, this is big, don't use it like that. The lumbar pillow is smaller, okay? I'm just giving you an example. Okay, so now when I'm working like this, at least my back is supported, okay? So that's what you need to focus on, the lumbar support. Regardless of that, if you're having a back pain, I would not suggest to sit more than 20 to 30 minutes. You can simply sit down, sit up, okay, and move around, just 10 seconds and sit down. That's fine. Why? I always tell, this phone is light. I can hold it. Ask me to hold for 30 minutes or 20 minutes. My shoulder will start getting pain. Why? Because of the gravity, okay? The gravity push on my shoulder and start getting tired. So think about it, when you sit, your gravity goes in your lower back, especially L3, L4, L4, L5, okay? So when you build up the pressure there, okay, you're gonna start getting pain. So regardless of that, if you're having a pain, 20, 30 minutes and stand up. Or simply you can just stretch side to side, go forward, shift the gravity, okay? And of course, you gotta make sure when you sit, see my leg is supported. I have about 4 finger gap between the knee and chair, okay? So in that way, everything is supported well. Arm has to be adjustable if I'm working like this, okay? Chair has to be adjustable, but especially your lower back, you wanna make sure you have support. If your chair has a hard support that can kind of go, you can adjust your backrest and you can go a little bit higher like this. When you're working, if you can pull up your backrest, great, okay? So that's for the sitting posture. Any question for sitting posture? Any specific question about the sitting posture, or this might give you an answer? Okay, all right. Now we're going to talk about the sleeping posture, like how people sleep. Now, if you can write down in the chat, I would appreciate it. That how do you sleep? On your back, on your side, on your stomach? Okay, thank you, Fatima. Okay, so let's talk about the sleeping posture. Okay, now when people sleep, let's say if I'm sleeping on my back, and if sleep on my back with the straight leg like this, throughout the night, if I'm sleeping like this, there are chances in the morning I'll feel stiff. Why? Because my lumbar is curved. Remember, the lower back is curved. Now, right now, that curvature doesn't have a support on the lower back, on the lower side. And that's the reason the gravity pushed down and I start getting strain on my back. How do I fix it? Bend my legs. Okay, so when I bend my legs, my back flattens. Now, can I sleep like that? Instead of that, what I can do, is simply keep a pillow, one or two, depend on your size. But when I do this, my back is relaxed. Then I'm okay. Now let's say you sleep on your side. So if you're sleeping on your side, people like this, then again, there are chances you're going to get back pain or back strain. Why? Because if you notice my hip, my knee is going down like this. So when that happens, it pulls right here. So instead of that, if I keep pillow between the leg, now see my leg, my knee, my leg is kind of in a line. When that happens, I don't have any strain in my back. Now, sleeping on your stomach, I do not suggest or recommend sleeping on your stomach. But I know many times people cannot tolerate without sleeping on your stomach. You absolutely have to sleep on your stomach. What I would suggest is keep a pillow below the hip. Okay, like this. So when you have this, your curvature again is supported around the hip. Have a pillow. Okay, so that's the good position for your sleeping. Now, okay, so as you said, Miss Fatima, that you cannot sleep on your back, you have to go on the stomach, which is fine. As I said, like, you know, that you had to, because that does increase your pressure in your back. Think about it, that curvature. So if you have to sleep on your stomach, you have to keep pillow below your hip, okay? Because that's where you can avoid the pressure on your back, okay? Yes, definitely looking at the phone. So text neck is a real thing, right? So if you need to watch the phone, this is how I get in habit. Because before I tell my patient I need to fix myself, right? Because a lot of patient comes with the neck pain. So I got in the habit that when I'm looking at my phone, of course, if I do this, it doesn't look good, right? I can't walk around like this, right? So when I look at it, what I do, I use my more of the eyeball. My hand is a little bit higher like this. So when I do this, so if you notice right now, my head is not leaning forward. My phone is just a little bit up and I'm using more of my eyeballs. Okay, so it's more like this. So when I do this, my posture is good. So if you notice, I'm not leaning too much like this, because going like this, definitely no. I have mentioned in the previous workshop, the weight of the head is about 10 pounds. Okay, 20, 30 pounds, 40 pounds, 50 pounds, 60 pounds. And these are real number. I have a postural software that we use to check the people posture. When I take the posture, that software tells me that how much their head weigh with that particular posture. Believe me, I had some people like, you know, even in the resting position, they weigh like almost 18, 19 pounds. So you're putting a lot of strain on your back muscles, your neck muscles, okay? So fixing those things definitely help. All those things you had to get in a habit. That's called muscle memory. You got to get in a habit, okay? All right, leaning forward, I think we already talked about it. I give the stick. When you get in a habit of like, you know, keeping your back straight and leaning forward, that helps. A lot of people know about lifting techniques, right? You use your legs, your knees, and trying to keep your back straight and use your body to lift the weights, okay? All right, so now talk about the treatment options, okay? So what are the options? Once you got the back pain, what we can do, how we can fix it, what are the treatment options that we have? Now, as we talked about the journey of the patient, right? Now let's talk about the steroid, okay? When doctor give you a steroid, what it does, the purpose of the steroid is to reduce the inflammation, okay? Now let me give you a little bit of example. Let's say your muscles are tight, like, you know, you injured your back, you were doing something, and like, you know, your pain just got worse. Now you got the inflammation in L4, L5, okay? When you got the inflammation in L4, L5, the response of the body, in, like, you know, for the inflammation is swelling, redness, okay? So all the localized areas surrounding your spine gets swollen, like it gets swollen, and it gets start getting red, And because of that, there is not much space left, which push on your nerve. And that's where you start getting radiating pain. Okay, or it doesn't allow your spine or vertebra to move freely, and every time you're trying to move, you're putting the pressure on that swollen area, which causes the pain. Now, what you do when you go see the doctor, they give you steroid in that area. What the steroid do? Reduce the inflammation. Now the swelling is down. When the swelling is down, now there is no pressure on the surrounding area, so you can move around better. Now, once you have a chronic pain, okay, all the things that trigger the inflammation could be tight muscles, poor posture, injury to your back, long habits of poor habits, arthritis, all those things accumulative comes back. So even though you take the steroid, it doesn't help in the next, sometimes it doesn't help, or it helps only for a few months, 2, 3, 4 months max. Okay, and after that, if you don't fix the root cause, like whatever the reason you had the inflammation, if you don't take care of it, you're going to keep on coming back. Okay, now you cannot take steroid too many times. Everybody knows that. Why? Because one, when you have steroid too many times, when I say too many times, there is a limit. Even doctor will not give you more than 3 or 4 times a week, 3 or 4 times a year, not a week, sorry. So if you take too many times, there are chances that it affects the quality of the bone, and that in fact lead to more arthritis in the long term. Okay, short term still okay, but in long term, not a good idea. It's not a permanent solution. You still have to follow the ergonomic. You still have to do the exercise. Rather, you start with the exercise. Okay. Second is the medication. So steroid works quickly because they give you a shot. It really helps immediately with the inflammation. Medication, naproxen, meloxicam, Celebrex, those are all Advil. Those are all the anti-inflammation. What it does, indirectly helps with your inflammation. Same thing. It reduces inflammation slowly. Steroid work faster on inflammation. Medication slowly. That's why your pain feels better, manageable. But what you need to do, fix your root cause. Otherwise, no use of medication. Exercise definitely helps. I tell people, if you don't have much back pain, you want to maintain it. Whatever you like, yoga, Pilates, but don't live in the pain. You got to, those things are preventative. Okay, not to fix your back pain. Yes, if you have minor back pain, it can help you for sure. Okay, but like that helps you to maintain your core stability. That helps you to improve your strength. Okay, and that helps you to avoid the inflammation. So that's more preventative. But once you have inflammation, once you have a back pain, you wanted to work on that. How do we manage the inflammation? So when I see the patient, the conservatively, what we do when they come here, we do the mobilization. Why mobilization? We're aligning the spine. Okay, so the pressure is less. We do the dry needling because we put the needle right to the muscles which are tight. It relaxes the muscles, reduce the inflammation. MPS, that we have started doing it, which we have seen tremendous good results. It's a microcurrent point stimulator. Okay, so those things helps with the inflammation. Okay, the other things, the cupping and gua sha tools, and those we do to relax the muscles as well. Sauna helps for sure. Shockwave therapy helps with the inflammation. So those are the way we do it without medication and steroid. Okay, yeah, and then exercise to maintain your back pain. So maintenance is the key. Once you get the back pain, you cannot imagine that, okay, back pain is gone. I went to the physical therapy, chiropractor, doctor, ortho, my back pain is gone, and I'm good to go. No, you have to maintain your back pain. If you don't, then you're gonna get the back pain. When I say maintain, that means you have to be active. You need to do the regular stretching. You need to do regular exercise. I'm talking about 10, 15 minutes. I'm not talking about spending too much time. That also maybe 2 or 3 times a week. Okay? All right. So for back pain, I can talk a lot. So I'm trying to finish, Any question so far? If you have not covered anything?
Dr. Sanket, this is Fatima.
Yes.
Like when you said that steroid is, if in future it affects your bones, right? Bone health. So
Yes.
my orthopedic believes in that too. So I've got the injections, which doesn't have the steroid. So first 2 times he gave me the injection to 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 detect where my nerves are. I have a lot of arthritis on my back. I mean,
Mm-hmm.
other than that, my back is, he said, according to the MRI, just a little bulge or this and that, but that is not the main concern. It's the arthritis built. So he first two times, like he wanted to identify where are the nerves that is affecting. Then the
Mm-hmm.
second two time, he said that they overheat the nerve, so the nerve doesn't give the message to the brain. In layman language, it says burning the nerve or what.
Yeah, they cauterize the nerve.
Yeah. So he did that last two times. Last Friday was my fourth one, and he did it half and half back. He said, "I'm not doing the whole back at one time, half and half." But I still have the pain. So he's going to follow up with me next week, but my
Mm-hmm.
back pain is not gone. And so to me, I think I need to do more exercise and eating habits to reduce the arthritis. But if you have any suggestions that I can do, I would really appreciate.
Yes. So one, you have to give some time because when they do all those things, it doesn't like sometimes it takes few weeks to see the results. Okay.
Okay.
So you have to give some time. Okay. And second, again, as I said, like they cauterize the nerve, that doesn't mean the pain will be gone.
He doesn't give me steroid at all. I have not
Yeah,
had
but
any steroid. He doesn't believe in giving the steroid to his patients. So
when they cauterize the nerve, not necessarily your pain will be gone because many times your pain is localized around your muscles. Because when
correct.
you have tight muscles, okay, that
Mhm.
is like, I tell many times, like, when your inflammation is gone, but if you have a spasm, that
Mhm.
spasm is not going to go away. That's in
Mhm.
muscle. Okay. So the spasm, like, yes, of cauterizing nerve, like, the muscle that is supplied by that particular nerve, which they cauterize, it might have helped that. But what are the other muscles involved in your back pain? That's the important part. Okay. And
Mhm.
again, what I would suggest for your long-term solution or maintenance is what you need to do is come up with a plan. Again, like, that daily, or like in your case, if you're having pain, daily exercise definitely to reduce the stiffness in your back. Okay. So the daily stretching for your back must, then you have to activate your deep core muscles. If you don't activate your deep core muscles, that means, like, that you're going to keep on straining your back muscles. So you have to activate your deep core muscles. And then after that, like, if you're having a severe arthritis going on, you have to maintain, like we have a patient who comes like once a month now just for needle. They just do the dry needling and they're good to go. Whenever
I
they
have
have flare up, they come here, they put the needle, because needle is kind of, see, dry means there is no medicine. Because there was a research done on the knee, where they put the steroid in the knee, and then they did the without the steroid. And when they did the research, they found out the effect was not that much different. Okay, so when the effect was not that different, then why put the steroid? So the
correct.
dry needling do the same thing. We put the needle in it, it stimulates the blood circulation. Okay, that
So
helps
when
the
I was
healing.
so when I was coming to you, I did had the dry needle that
Mhm.
relieves me for a week, but then again, it's there. It doesn't
Yeah,
go
but
away.
that's why I said,
It doesn't
that's the
treat.
reason I said maintenance, because that alone dry needling not going to help. The
Mm.
purpose of the dry needling is to reduce the inflammation, yes, but that alone is not going to help. If you don't do your regular exercise, if you
Exercise.
don't maintain your core stability, then
Mm.
it doesn't matter what you do, it's not going to help. The
Mm.
purpose of the dry needling is, I would say, about 30% of the out of 100%, 30% dry needling, 30
Mm.
to 40% your regular exercise, 30 to 40, like about 30% is your posture, like your habits.
Bottom line is exercise.
Yeah, so when you combine all those things, then only help. Because I know many times when patients come, they just think one thing, okay, if I do this, I'm good. No, with back pain, neck pain, it's a comprehensive approach. You have to come up with everything. You cannot just depend, okay, if I just do dry needling for the rest of my life, my pain is gone. No. If I just do the exercise for the rest of my life, well, it can help if you do it right way and if you do the right one. Okay. All
Thank you,
right.
Dr. Sanket. Thank you so
Yep.
much. Appreciate
No
it.
problem. Okay. Anaka has a question: how to prevent lower back, especially you lift your legs, lower back hurts. Okay. So when you lift, that need a consultation, because when you lift your leg and if it hurts, we do the test like called SLR, where we lift the leg and we see what level you have a pain. Based on that, we know what area is affected. Is it like a diameter? Is it like a muscle? So based on what, like, so for example, if I start lifting my leg, is my pain at 40 degree? Is my pain at 60 degree? Depend on that, we know what it is. Now, to prevention, like back pain prevention, I think as you mentioned, posture is definitely one thing. I tell people these things. Let's say if somebody has a back pain or arthritis, let's talk about like, any of those things. You need to make sure in your routine you have range of motion, stretching exercise, you have strengthening training, and you have some cardio. You can do 5 minute, 5 minute, 5 minute. That's okay. But at least do 5, 5, 5 or 10, 10, 10, whatever you can. If you are not active, okay, there are chances that you're going to end up with some kind of pain. Okay, not back pain, then something else. That spending half an hour on yourself is very, very important. Okay, and what you need to do is a little bit like find out in detail that why when you lift your leg is hurting. Okay, because that I cannot just like, I need to do the consultation to find out more about it. Like, okay, what exactly the causing pain? But when you lift your leg and when you back pain, which is like, as I said, like it's called SLR, straight leg lift test, and then we can find out more about it. But yeah, maintenance definitely prevent, like, yoga, Pilates, all those things are preventative care. If you're regularly doing that, it helps. Okay. I hope I answer your question. I know it's not very specific, but again, like, back pain is more customized. So I always need to get a little bit more information to go in detail about the topic. All right, guys, any more questions? Okay. Yeah, anytime. As you guys know that every third Wednesday we do the workshop. We come up with the different topics. Next month, we're gonna talk about the posture and neck pain, especially people who are working on the desk. So if you're interested, email us or call us. Okay, our email is info@surecarewellness.com and our phone number is 469-212-8888. And any of you guys who attended this workshop and they wanted to do free consultation, we do offer free consultation. You live close by, great. If you live far and if you want to do the Zoom or on phone consultation, no problem. Okay, but at least understand about your back. Getting more personalized care is definitely needed when you have back pain. And any question, any concern, just reach out to me. You got, I think Nikki put down the number here. You can text us, call us, no problem. Okay. Or I will see you all next month, Wednesday, third Wednesday. And again, I think we're going to do the topic on neck pain and upper back pain. And right, like, just send us more questions, because I love to answer those questions in the workshop, because that makes my presentation easy, because then I don't need to think about the question. I just need to answer the question that's been asked. All right. Okay. Thank you so much, Naga, for attending. And yeah, I hope you guys learned something new today. I know, Walter, you have attended some of the back pain before. Hopefully you learned something new today. Okay. But I'll see you all next time. All right. Thank you. Bye.